hop in on here and give me some advice. I was asked to do a urinalysis drug screening due to coming to this hospital and not having OB care since I've moved into the area. I would be perfectly fine with giving that test. I have no issues. However,
It was a hard video to watch as someone who works in healthcare. All right, this lady is on here complaining about the fact that the hospital wanted a urine sample from her while she's pregnant because they want to make sure everything was okay, which is common practice. I mean,
right. So I don't get this, right? So this lady came on TikTok, asked for an advice. So according to her, right, she's pregnant, right? She's a pregnant lady and she went to the hospital. I guess she was experiencing some kind of issues with her pregnancy. So she went to the hospital, and then when she got to the hospital, they told her that they need her to like give them a urine sample so they can run some tests, right? And she said no. She said no, she needs to think about it and stuff like that. And then according to her, they went ahead and did a test anyways without her giving any kind of sample. She doesn't know where they got that specimen, like the sample, like the specimen from, for them to like run the test. It's just a whole bunch. So I'm going to show you her videos right now.
I need a Jen Hamilton or somebody of the sorts to hop in on here and give me some advice. I was asked to do a urinalysis drug screening due to coming to this hospital and not having OB care since I've moved into the area. I would be perfectly fine with giving that test. I have no issues. However, the person who asked me about the test was very intimidating and threatening. Therefore, I asked for time to decide. That nurse also told me that she had canceled the order and that I would have time to decide. Many hours goes by. I'm puking. I'm not feeling the greatest. I have not peed. I have not given any kind of samples or anything. I've been laying in bed. The doctor comes in and she apologizes for some things that had happened earlier in the day. Mind you, she tried to give me a medicine that I was allergic to that was properly documented into my chart. She also apologized for not continuing IV medications while I'm actively puking and trying to force oral medications on me. And she also, which is the biggest thing, she also apologizes to me for running a test that I have not consented to. I have not given a sample, like I said. I've not peed in a cup, not peed in a hat, not peed on the floor for them to scoop up. Like, not exactly sure where they got the specimen from. So I just want to know what my options are, what I can do. Because I've already asked for the director, I've already asked for the care manager, and I saw the care manager. She was very nice, had a very good conversation with her. I asked her to properly document this instance in my chart, which she documented everything except what I needed her to document. So I need your guys' help. I thought I wanted to give birth here. Now I'm thinking I don't want to. Looked at the Google reviews on this hospital, and most all of the 1-star reviews are from labor and delivery, unfortunately. So anyways, I just need help. I don't know what to do. I have no family or friends in this state. I have no advocates besides myself. I've tried to talk to patient advocacy. I don't feel like I'm being heard. I don't know what to do. I need help. I need to know more about the situation and what I can do. So if there's anybody out there who can help me, I would greatly appreciate it. If anybody can get Jen Hamilton on here, I would greatly appreciate it even more.
I'm looking for fucking advice. You're not fucking looking for advice. They're asking you why wouldn't you just consent? And you're just like, blah, 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 blah. Girl, you signed forms. People are gonna do tests. This lady's like, this is why I'm leaving, because you make my job difficult. And you're like, good for you. You have absolutely no recourse in this situation. You're just being difficult for difficult purpose. There is no other way to go about it. Like, you should have been taking a fucking urine test. It's not about you. If your baby is fucking in harm and you're throwing up and all, and you haven't peed, maybe you fucking do something about that. That's why you're fucking there, but you want to know what you can do because somebody touched your pee? You fucking sign consent forms. These kind of tests are fucking normal. It's not like they took your blood, bone marrow. Like, it's pee. And, like, I don't know if you're, like, one of these, like, new mom type situations where, like, you know better than every fucking doctor in God's name, like, probably voted for RFK Jr. Like, I have no patience for shit like this. Get the test done because it's not fucking about you. It's for your fucking kid. And if you can't do that, then you shouldn't be a mom.
Funny thing, Jen Hamilton never shows up, but a lot of other nurses do, and they have a lot to say. Let's get into these comments. Mind you, even though she tagged Jen Hamilton in her video, Jen Hamilton is not in the comments spooky, and for good reason. Continues to ramble along, and plot twist, she never fucking gives a urine sample, which to me, I've been pregnant. I don't understand what's the problem of doing all the tests that you need to do to make sure your baby's okay, unless you're hiding something. And a lot of nurses agree with me on this. This commenter says, all of this because they asked you for a urine screen. Then she goes, that I never consented to. Yeah, honey. Why does it fucking matter? I don't understand. Why? You always give urine when you go to the OB office. Like, that is just common practice. This commenter goes, I don't understand what the problem is giving a urine sample. She writes, I don't understand what the problem is of letting someone decide whether or not to consent to something. If someone was given the option to decide, then that should be that, not overpowering someone and doing unethical things behind that patient's back. She's doing a lot for a fucking urine sample. Like, you don't have anything in your system. Why does it matter? Now, here comes the nurses. This nurse, all of this over a drug screen. Labor and delivery nurse of many years, drug screen with no prenatal care is routine. This nurse right here, as an ER nurse, the only time I've had a PT refuse or think about a urine test is when they're paused for effect on rugs. This commenter writes, hi, I'm an L&D nurse, and anytime we don't know somebody's history, we do a drug screen. You have to remember we aren't police. It's information we need to know to best care for you and your baby. I agree with that. I don't understand the problem with giving a fucking urine sample. Commenter writes, nurse of almost 10 years here. Right off the bat, 10 seconds in, and I can tell you there's a lot more to this story. This commenter comments, also a floor nurse, but as a mom, why wouldn't you just want every single possible test ran? Take my blood, take my urine, take any test you want. Just make sure my babe is okay. Run all the tests. I agree as a mom and somebody who was pregnant. I had no problem like getting tests ran. I hate giving blood. I have a phobia, and I still went and gave blood every single time, even though I had drugged my feet and I was like, had panic attacks. I still did it. So this commenter writes, all my nurses in here know exactly what's up. 4,000 likes. This other person writes, I just know those nurses were tired. I know nurses get tired of y'all because y'all be doing this the most ridiculous ass shit for nothing. This one sent me, you need time to decide about giving a urine sample? This one sent me, goes, wait, why do we need Jen Hamilton to tell you a urinalysis and talk screen are totally normal requests? I peed in a cup every single appointment for both my kids. 5,000 likes. And yes, I did. Every single time I went, I was peeing. I would literally drink water before my OB appointment just so that I had enough pee. Like, that's what you do. This person goes, I don't know what to do. Give the sample. I've had 3 kids and have never had to think about giving a urine sample. This person writes, don't be bothering my girl Jen with this. Don't worry, Jen was not in the comments anywhere to be found. She don't want to touch this with a 10-foot pole, and neither would I, because this lady, there's something going on. There's something off here. This ain't it. Jen already knows. This person goes, you not giving a sample is weird. And I agree. Very weird. Like, I don't understand what the problem is. Like, if you're not doing rugs, why don't you just give the fucking sample? Why do you have to make everything so hard? Why do you have to make the nurses' lives hard? Why are you coming onto social media? Because now the comments aren't in your favor. Nothing is in your favor, and people see right through you.
Hard video to watch as someone who works in healthcare. All right, this lady is on here complaining about the fact that the hospital wanted a urine sample from her while she's pregnant because they wanted to make sure everything was okay, which is common practice. I mean, even when you're not pregnant, you go to the hospital, they want a urine sample. It's what happens to everybody. But she over here is like, I don't feel comfortable with giving a urine sample. I don't want to give a urine sample. And that is raising enormous red flags in healthcare, because why on earth, why on God's green earth would you go to the hospital while you're pregnant and not want to know if everything's okay with your baby? Simply give the fucking urine sample and then they can tell you if everything is okay with you and your baby. Like, my question is, are you trying to get a payday because you said the hospital got labs on you and you're not sure how they did that? Or are you taking things that you shouldn't be while you're pregnant and you're scared you're gonna get in legal trouble? Like, I don't know what the purpose of this post was. I'm surprised it's still up, but you guys should go watch it and tell me what you think. In my opinion, super suspicious, red flags everywhere.
Good morning. While I'm not Jen Hamilton, I am a certified birth doula and I've been in this profession for over 12 years. I'm not giving medical advice. I am not a medical professional, but I do have some insight as somebody who has worked in labor and delivery for 12 plus years. You didn't give us a ton of information about your pregnancy and what could be going on in that video, so I did a tiny little deep dive into your account. And I see that on December 12th of 2025, you posted a video stating that you were 16 weeks pregnant and you were having trouble eating. So that tells me that as of today, March 6th, you are roughly 27 weeks pregnant. You do have a hashtag at the bottom that says labor, and I'm not sure if you're in preterm labor or if you're experiencing preterm labor or you're just at labor and delivery because you're not feeling well. So in that situation, a urinalysis / tox screen is all completely within the realm of normal for this situation. If you present into labor and delivery at 27 weeks and you're not feeling well, there could be a whole lot of things that are going on, and the tests are the best way to determine what's happening. That urinalysis is looking at proteins in your urine to see if you're preeclamptic. It's also going to be looking for any kind of bacteria because UTIs and kidney infections can actually make you feel absolutely terrible when you're pregnant and can also lead to preterm labor. I know that you're saying that this hospital is not making you feel very comfortable, and I totally understand that. And if this hospital is not a choice for you, you can always go and seek other care by maybe posting on where the social media accounts, I don't know if you have a Facebook or whatever, moms groups in that area, and ask for feedback about what kind of birth you're expecting and what hospitals kind of live up to those expectations. And while it is perfectly within the realm of normal to decline specific tests, if you are in fact 27 weeks pregnant, then I don't know that I would want to decline too many because I would be worried more about the health of my baby than I am about a urinalysis, especially if you're clean. But again, you are absolutely entitled to decline whatever you want. But these are the expectations I always put forth with my clients who are looking for these hands-off birth approaches when they're birthing in a hospital, is that you also have to understand that you are birthing in a hospital. And while you can still control some of the things in your experience, just know that for liability reasons and for charting purposes, there are certain tasks that nurses and doctors have to do to also protect themselves, that in the event something goes awry with your birth, they can say, well, these are the things that we did, this is what happened, to help figure things out. These are conversations that I have with my doula clients all the time who are looking at these hands-off births in hospitals. I have to say that there are certain things that you know that you're going into a hospital for that you're going to have to be okay with. You consented to an IV that I could see in that picture, so that tells me that any kind of tox screen they wanted to do, they could have done on the blood that they pulled when they did your IV. But when they also take your blood when they are doing your IV, they're also typing crossing your blood to make sure in the event that you start bleeding during your delivery, they've got the right blood for you. There's a lot of things that go into those situations that we have to be mindful of. But I wish you the best. I hope everything is well and that you get the care that you deserve.
I don't see what the problem is, right? I don't see what the problem is about them asking you to give them the urine for them to run some tests so that you and your baby are safe. Every time, every single appointment that you have with your OB, they ask for your urine so they can run tests to make sure you're okay, the baby is fine, there's no any infection, bacteria. I don't know what they're looking for, but just so you are okay. As a pregnant lady, I don't see what the problem is. I don't see what the issue is. I would let them to run all those tests to make sure my baby is safe, to make sure I'm okay and my baby is okay. You know what I mean? So her going to the hospital, and then first of all, why go to the hospital if you know you're going to be combative anyway? I know it's her body, it's her choice, but you went to the hospital because you are experiencing issue. You went to the hospital because you are in pain. You went to the hospital for them to take care of you, right? That's the whole purpose of you going to the hospital. Because if you know you wasn't going to take the medication, you wasn't going to take IV, you wasn't going to give them any samples to run tests, why then go to the hospital? You know, why show up to the hospital so they can do something so you can now turn around and sue the hospital because you are going to claim, oh, I didn't consent to this, I didn't consent to that. You went to the hospital for a reason, lady. You went there so they can treat you. I don't understand people's reasoning of concept of reasoning. You know, like, I don't understand why you went to the hospital, then you refuse treatment. you know, and you are pregnant and you don't have OB. Call your OB, your old OB, tell them, oh, hey, this is where I'm moving to. Like, this is my new OB. They are going to give you, they're going to send over your medical records to your new OB. You know what I mean? But I doubt this lady have OB. I doubt she went to the hospital for like any kind of like checkups throughout her pregnancy. You know, because the way she's acting at the hospital, I don't know what's going on there. But I just kind of feel like if you're going to be refusing treatment, if you're going to be refusing and combative about like whatever it is that they suggest, don't go to the hospital. Don't go. These people are they're already stressed out by like being on their feet, you know, taking care of like 5, 6 patients at once. You know, they don't have the time to deal with your bullshit. Just stay at home if that's what you want. Don't show up at the hospital and then try to argue with them. They don't need that. It just healthcare workers are already stressed enough. You know, they're working way too hard for you to come there and stress them on top of it. I don't get it, but let me know what you think about this story down in the comment section below. Thank you for watching, and I'll see you all in my next video.